lecture is going to be about potassium, specifically what happens to the body with low potassium or high potassium levels. So hypokalemia is a potassium level less than 3.5. Hyperkalemia is a potassium level greater than 5. Just small little increments in potassium can have a big effect on the body. So potassium is a really important electrolyte for you to understand. Okay, now potassium helps muscles contract. So that's the skeletal muscles. So people with low or high will have muscle weakness, the smooth muscle and the cardiac muscle. Okay, so we're going to talk about that later. It helps to transmit nerve impulses between the brain and digestive organs. So if somebody has a low potassium, their bowel sounds will be low, they'll have constipation, and they could develop an ileus and obstruction. If their potassium is high, they're going to have hyperactive bowel sounds and diarrhea. It helps with acid-base balance. So people with hypokalemia are going to have metabolic alkalosis, and people with hyperkalemia are going to have metabolic acidosis. All right, so let's talk about recognizing cues. So what are the causes of low potassium? I'm going to go through low potassium first. So you can remember the mnemonic ditches. So all these kind of conditions ditch K from the body. Okay, so D stands for drugs. So furosemide, which is a diuretic, and there are other diuretics that also remove potassium because potassium is excreted through the urine, okay, from the body. Laxatives, potassium can also be excreted through the stool, and glucocorticosteroids, so people that are on steroids, they could have a low potassium. Inadequate intake, so somebody that maybe is on a diuretic that causes low potassium and they don't eat high potassium foods like a banana, all right, that could cause low potassium. Too much water intake can also cause low potassium. Cushing syndrome, you're going to learn next semester. Heavy fluid loss. Okay, so as I said, potassium is excreted through the kidneys into the urine. Okay, it also, having a low potassium can also cause what's called nephrogenic diabetes insipidus. Now, you haven't had diabetes insipidus yet. You've learned about diabetes mellitus, which is, alterations in sugar metabolism. Diabetes insipidus refers to a condition where there is a large urine output, has nothing to do with sugar. Now, you don't need to write all that down. I'm just giving you some background information. I'm going to be teaching you about diabetes insipidus next semester, but that's the reason why somebody with a low potassium has lots of urine output. And also, somebody with lots of urine output is going to have a low potassium, okay? Tap water enemas for E. You never want to give more than 3 tap water enemas because it could cause the patient to have low potassium, among other things we'll talk about later. Suctioning, so NG tube suctioning. If you're suctioning the fluid in the gastric contents, they're high in potassium, so they could have a low potassium, but which can also lead to metabolic alkalosis. Okay. Now let's talk about the signs and symptoms of low potassium. You can remember the 9 L's. So they'll have a low BP and they may be orthostatic. Anytime I say orthostatic hypotension, you should automatically be thinking, I have to teach my patient to rise slowly. I have to make sure the bed is in the low position, the call night is within reach, because they're going to be at risk for falls, okay, and dizziness, of course. They're going to be lethargic. And so they could be apathetic, they could get confused. So some type of change in their LOC. They're going to have low, slow, shallow respirations. They're going to have lethal cardiac dysrhythmias like tachycardia, PVCs, and we'll go more in depth in the cardiac lecture, but you do need to know that potassium can cause lethal cardiac dysrhythmias, and if you have low potassium, it could result in tachydysrhythmias like tachycardia. Lots of urine, because I explained what potassium can do to the kidneys, low potassium. Leg cramps, limp muscle, so that means weak skeletal muscle, which are going to put them at risk for falls too. Low blood pressure, of course, less stool, so because they may develop an ileus or the bowel slow down. Low amplitude of pulse, so the pulse could be irregular, thready, and weak. Okay, so amplitude of pulse, I'm not sure if you've had this assessment finding yet, but when we check a pulse, we check not only the pulse rate, but we want to know what the strength of the pulse is. So plus, it's graded on a 4-point scale. So +1 is too low. That's not normal. +2 pulse is normal. So you want to see a pulse +2, +3, or +4. Those are the different grades, okay? So +1 is too low. So that's what you would see in somebody with hypokalemia, okay? Now the labs, of course, the potassium is going to be low, right? So less than 3.5. They could have a metabolic alkalosis, which often goes with the low potassium. You're going to do an ECG on anybody that has a high or low potassium because the heart muscle likes potassium in the Goldilocks level. That's what I call it. So it likes it in the normal potassium level, okay? If it's too low or too high, the heart's going to go awry, okay? So the treatment, the nursing care, you're going to give potassium, either PO or IV drip. We never give it IM, we never give it SC, and you never, ever, ever, ever give it IV push because it will kill somebody, okay? And I had a coworker that did give it IV push because back in 1987 when I graduated nursing school, we didn't have Pyxis. We mixed our own medications at the med cart, and she mistakenly grabbed potassium instead of furosemide, which was Lasix, which was kept on the chart too. And she gave 40 MEQs IV push to a patient, and the patient died. Luckily, I worked in a place that didn't believe in firing nurses for making medication errors, especially when the potassium was on the cart and we were required to mix our own potassium. So she practiced nursing, and anyways, that's just my little rant that I want you to know, to never push potassium. Never give it IM. We only give it drips in small amounts, okay? They must be voiding 30 mLs an hour for you to give potassium. The reason is because potassium exits the body in the urine. So they have to be voiding before you give potassium because they may end up with too much potassium if they're not. You're going to check the respirations because in between each rib is the intercostal muscle, in that skeletal muscle, and that helps with breathing. So if they have a low potassium, they're going to have weak muscles and they may not be breathing properly. Monitor the cardiac rhythm for those tachydysrhythmias I talked about. Monitor the potassium before giving digitalis. So if somebody has a low potassium and you give digitalis, they could become dig-toxic. And I'm sure you're going to learn about that in pharmacology. Monitor the LOC because remember they can become lethargic and confused and somnolent. Check hand grasp to check for the skeletal muscle weakness. Monitor their bowel sounds because with low potassium, the bowel sounds are going to be hypoactive and they could develop an ileus and then a bowel obstruction, and we don't want that, right? Monitor the deep tendon reflexes. All right, they're going to be low with low potassium. And monitor the IV site, especially when you're giving potassium because it can cause phlebitis, and I know you had that in IV therapy. So the foods high in potassium, you're going to encourage foods high in potassium. Obviously, anybody on a diuretic that diuretic causes loss of potassium, you're going to encourage them to eat high potassium foods. So you can use the mnemonic potassium S, and P stands for potato, especially the skin of the potato. Plantains, which are also like bananas, right? O is for orange, T for tomato, A is for apricot, S is for strawberry, S is for spinach, I is for iceberg lettuce, U is for ugly fruit, and mango for M, and honeydew melon is also good, and cantaloupe is good. Salt substitute. So you want salt substitute is high in potassium. All right, now let's go into high potassium. Now, the reason somebody would have a high potassium, you can remember cared. So C stands for cellular movement of intra to extracellular. So the potassium lives inside the cell, most potassium, right? If there's acidosis, potassium is going to come out of the cell, and that's how like people with high potassiums, they're going to have acidosis. Okay. Adrenal insufficiency, you'll learn about that in Med Surg 2. Renal failure, I'm going to teach that to you in Med Surg 2. But what I want you to know now is that if somebody cannot void, right, they have oliguria, which means low urine output, or anuria, which means no urine output, they're going to develop high potassium because potassium is excreted by the kidneys through the urine output. Okay. Excessive potassium intake in drugs. So ACE inhibitors, ARBs, and NSAIDs and spironolactone. So you'll learn about that in pharmacology. Murder. You can use murder to help you remember the signs and symptoms. M stands for muscle weakness. We talked about that. Hypo and hyperkalemia both have muscle weakness. Now, the difference with hyperkalemia is the muscle weakness is ascending, which means it's going to start in the lower extremities and move its way up. So you have to worry when it starts getting to the hips, the thighs, hips, and coming up, that the weakness is going to decrease their respiratory muscles. So they could have respiratory failure. U stands for their output is low. I talked about that. R is respiratory failure because they have that ascending weakness I talked about. D is for decreased cardiac contractility. So the heart is not going to pump as effectively. So they're going to have a weak and thready pulse. They could have a low heart rate, heart blocks, hypotension. So both hypo and hyper can have hypotension and respiratory failure. And with the D, also remember diarrhea for high potassium. They'll have early muscle twitches, enteral rumbling for the hyperactive bowel sounds I talked about earlier, rhythm changes in the heart. Okay? The labs, they're going to have a high potassium. They could have a metabolic acidosis as well. And the diagnostic test is the ECG. So obviously with both hypo and hyper, I talked about preventing falls, and you know the interventions that go into that. We're going to monitor the cardiac rhythm, whether it's low or high potassium. Just a little bitty change in the potassium could cause heart problems. So you want to get that patient on a monitor as soon as possible. Make sure they have IV access too, always. Check for muscle weakness. Remember, it's going to start in the lower extremities with hyperkalemia. Calcium gluconate. Now listen carefully. Calcium gluconate is going to be the drug of choice if somebody has a life-threatening dysrhythmia and a high potassium or a high magnesium. Okay? It doesn't lower the potassium, but it protects the heart from the effects of potassium on the body. Okay? So you're going to give that for high potassium, high magnesium. Okay? If they have life-threatening dysrhythmias or they have slow respirations or low respirations, okay? So you're worried about them having a respiratory failure. All right, for the drugs, you can remember the mnemonic kind. So Kayexalate, that takes a couple of days, and that helps remove, that's going to give them like a diarrhea so that they can excrete potassium in the poop. Insulin and dextrose. So sugar and insulin move potassium inside the cell. And then sodium bicarb, which we really don't give that much anymore, but it could be an option. They may also opt to give them furosemide. So in other words, give them diuretics as long as they can put out urine so that they can lose that urine the potassium in the urine. Foods low in K, so apples, corn, pineapple, grapes, green beans. Those are the foods that are low in K. Um, and then that's really it. That's all I want to say about potassium. We'll learn more throughout the semester when I go into cardiac.